welcome to the office. Julie, welcome to the office.
Thank you for having me.
You're welcome. So how did you find me? First, I want to talk about that.
I found you on TikTok from your jaw adjusting videos.
Okay, and we have quite a few jaw adjusting videos.
Yeah.
Now, this is a little different for me, guys, because most people come here from YouTube. And lately, there are people coming from just TikTok that have only seen TikTok videos. And the thing about TikTok is they're really short. They're like a minute, 2 minutes, 3 minutes max, I think. And on YouTube, we share a journey, a series. And maybe we're going to start yours today.
Okay.
Okay.
Cool.
All right. And so I just wanted to share that with the audience. Okay, tell me what brings you to the office.
Specifically TMJ.
Okay.
Like a little bit of a deviated septum.
Okay.
Are my main concerns, biggest focus, and then shoulder from an injury that I had.
Okay. What kind of injury?
Severed nerves injury, where I severed my median nerve, and so there's a lot of overcompensation in my shoulder specifically. Some pain in my knees when working out.
Sharp pain in your knees?
Sharp pain in my
So
knees.
some pain or sharp pain?
Sharp pain only when it's present.
And only when you work out, or only when you're bending, squatting, or
Only when I work out.
only
and,
when you work out?
Yeah, and
Okay.
not always,
and
every time.
Specifically doing what?
Anything that's just like me bending.
So squats?
Squats would maybe do it.
Or even abs or any on your back?
When I'm on my
knees?
back and like bringing my knees in.
Okay.
So actually not with like a lot of weight on it.
Okay, so non-weight bearing, you feel it more?
Yes.
Okay, that's important.
Yeah.
Okay. All right, what else?
I think that's about it.
Okay.
Like, yeah, just full body, everything.
So we're going to check you out, right? We're going to check out the whole body. We're going to go over your x-rays first.
Okay.
I'm going to explain kind of what I see, and along the way you have questions, you ask, right? I want to make sure you understand what's going on. Now, she came in, guys, for TMJ and deviated septum and breathing issues. And what I'd like to explain to new people that are watching is we look at everything. And so first thing is, do we have proper nerve supply going to all of this coming from up top? But if we don't have a level base and foundation kind of holding our structure up, then whatever we're going to do down up top is not really going to hold. Does that make sense?
Yeah.
Okay, let's go over your x-rays. Let's see what we find. All right, let's start the journey. This is you, Julie. This is a picture in time. Tells us how you've evolved from birth. We have 24 bones in the spine that move, 23 discs in between. We have the pelvis and the sacrum, which is the foundation. So I want you to think this is your 24-story building. This is the foundation of your 24-story building. In order to have a stable building, we need to have a level base and foundation. Does that make sense?
Mm-hmm.
That's number one. Number two is we're looking at the side profile. And on the side profile, we're talking about posture. Okay, so the first thing is let's look at your posture. We're going to run a posture line, and the line goes from the lowest lumbar, goes up. This line should bisect the 7 and 2, C7 and C2. So this line, Madam, should actually be way back here. And what that's showing us is what? You carry your upper body behind your foundation. Okay, and that's significant. Why? Because all of these muscles in the shoulder are working overtime just to kind of hold your neck up. Does that make sense? So all this is working overtime.
That looks so off.
It's off a bit, yes, it is off a bit. And that's the posture, and we'll go into more detail in this later on, okay, in the discs. And there's a lot of good news here too, but I gotta first go over all the stuff first. Okay? All right, let's do it. Now, let's go through the foundation. Now, you see curvature. It curves this way, it curves that way. There's a nice curve here on the right side. This is the heart shadow. This is the Megan Blasi, gastric air bubble, and we'll go over some digestion stuff. But for the most part, we can see this right side, and you said you're a hairstylist. So you're right-handed?
Yes.
Okay. Are you ambi by any chance?
Not really.
Okay, so a lot of your stuff is right-sided. Okay. So when we're looking at it this way, the overall effect is what? The whole right side, it tilts to the right side, right? The convex side. Pulling to the right side. And we need to see why. Now, when we look here at the foundation, what are some of the things that we see? First thing is, yes, one hip is lower than the other. You see the right side is a little bit lower. So theoretically, if you're non-weight bearing, it's going to present shorter. So your left leg would be longer. Okay? Mm-hmm. But it's not that it's longer as such, it's that the pelvis is off.
Okay.
All right, we're going to go through the numbers. And you have an old tailbone injury. This is your tailbone, and it bends. It bends right here at the S5 coccyx area. When I'm looking here at the pubic bone, did something happen there? I don't know if it was shear or something.
I had a snowboarding accident. Okay. A different one.
Now the fun, now the truth is coming out.
I forgot about that.
Okay,
one.
so you see this should have, this is almost like an avulsion, like you almost pulled on the muscles and ligaments.
Okay.
It looks like an avulsion. So you see those little bumps right there?
Mm-hmm.
They shouldn't actually be there. I'm just saying. But they're there, it's fine, it is what it is, and your body has adapted. Okay? Now, hip sockets are good. This one is a little bit less than this side. Hip sockets are good overall though. Sacrum, when we look at the sacrum, we can see through the joint line, this is the SI joint. It opens up a little bit more, you have a good space in through there, all the way through. Now look here, that's scar tissue. It's a little more jaggedy through there, and that's scar tissue in there. So we need to look at the numbers and see kind of how it's misaligned. So we have a few things going on here, and this is your foundation. So when we're looking at the foundation, what do we see? We have a rotated sacrum on the left side, but it's dropped on the right 3 millimeters. We have a measured difference right now of 7 millimeters. Follow my process now, please. Your right hip is 7 millimeters lower than your left. If I correct your pelvis, I will actually make it a little bit worse. So the answer is not in your pelvis. Follow.
Okay.
Follow. Left pelvis, ASEX, so it goes up, turns out. Sacrum on the left side goes back and then goes down. So follow this. This goes up and out. This goes back and down on the right. And then the whole thing shifts on the right.
What connection point are you talking about here?
This is your left SI joint here.
Okay.
So I'm referring to the pelvis right here. This is your this is the back. These are the bumps in the back here.
Uh-huh.
Okay? So this is referencing the PSIS to the sacrum.
Okay.
Now I do want to explain this. When we look at the SI joint, it's called an auricular surface or an auricular shaped joint. Like the auricle of the ear, it's got an irregular shape.
Okay.
Why that's important is this: it dictates the way it moves. When it goes down, PI, this way, it naturally wants to go out. When it goes up, it naturally wants to ride in. So ASIN, PIEX. Your misalignment is ASEX. So that was from one of the injuries.
Okay.
That was the point of that.
Okay.
Okay? We have a rotated sacrum on the same side. What the book tells us to do, if we have a rotated sacrum on the side of an EX major, the book says to do the pelvis. However, if I do the pelvis right now, it's going to increase that leg length.
Okay.
So the answer is going to be first somewhere in the sacrum. 3 millimeters of that is coming from there. Now here's the cool part. If we can get the sacrum sorted out, get 3 of that 7 at 4, and then we can work on the pelvis, you're still under 7. And in the work, anything under 7 millimeters, adjustments will hold. So you're right at that border.
Okay.
That's the point of it. Make sense so far?
Yeah,
okay.
As much as I can comprehend.
Okay. Let me rewind then. I want to make sure you understand. Your pelvis is misaligned along with your tailbone.
Okay.
I'm going to keep it simple. Okay, no problem.
I was pretty much following.
Okay, but I'm going to repeat it one more time because I'll get those, people that'll be like, can you just explain it simple? Let's explain it simple.
Very simple.
You're very simple. Your left pelvis goes up and out. your tailbone goes back on the left side. Your tailbone, along with your hip, is shorter on the right side. That's your imbalance.
Okay.
And that has created an imbalance in the rest of your spine.
Okay.
Okay? Real simple. Now, let's go to the full spine and take a look at what it's done. So from that, what's happened, it's curved. 5, 4, 3, 2, 1. So you have your 5 lumbars. Now, when we start to look here, from the mid-back, that's when things start to get a little bit fun. And they look a little compressed. And there's an interesting finding here if we want to share. And 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13. So typically in the spine, we have 7 bones in the cervical, 7 bones in the neck called cervical, C1 through C7, 12 in the mid-back called thoracics, T1 through T12, 5 in the low back called lumbars, L1 through L5. And our friend Julie here happens to have 13 thoracics. It's kind of cool.
Little alien on Earth.
That's okay. That's okay. I have one other patient that has it. So when that happened, I called up my mentor because I didn't understand. This was years ago. I still have that x-ray too. And I said, Doc, what do I do? This person has 13 thoracic. Okay, so he has an extra pair of spinal nerves. And that's not bad, it's not good. It's just whatever it is for you. All good. Cool.
Cool.
Now, does that make sense so far?
Yeah.
Now let's go up top to the upper back, mid back. You can see the kink. Now this is what's important relating to your TMJ first. You deviate from right to left, but then you compensate left to right. So whatever is happening in the neck is compensating for the rest of the spine. When we look at your TMJ, it deviates to that right side. Yes, you can see it. But here's the interesting part. It almost looks like you're also compensating on the same side. We call it a right AI, where it goes anterior inferior away from the, if this is on the left side, the problem is on the right side. And then the jaw usually compensates, and it compensates to make the mouth open straighter. And we would expect this to be a wider length. But this is a wider length, so it'll be interesting to see on you what it is. Now, there is a slight deviation of the septum. We'll check it out, which is also going to the right side. So we have a right TMJ, we have a right deviated septum, we have the pelvis, sacrum to figure out where we're going to start. Now we want to go to the side profile and look at your discs, and now I'm going to give you the rest of your answers. When we look at the discs should be level and parallel, okay? They should look like that, like that. This tilting, the discs are fine, they're just tilted because of the curve in the other x-ray. But here's our answer. Our answer is the tailbone. Our answer is your sacrum. Because when we look at your L5 disc, we can see the sacrum is open at the back, the disc is open at the back. That doesn't line up with that. So this is a sacrum case.
Wait, what part doesn't line up?
Let me show you. This part. So the back here doesn't line up with the back here. We call it a base posterior sacrum.
Got it.
Okay, so your tailbone is back and turned, and that's what we have to work on. Okay, now here's the other piece of the puzzle. There's a bent coccyx S5, so we need to bring this up, this piece here. So we have the coccyx that needs to go forward there onto S5, and we have the sacrum. I do have a video, it's probably on TikTok too, where I adjusted her coccyx to sacrum, and then I did the sacrum, same visit. It's what you can handle. We'll see when I examine you what you can handle. Okay? And yeah, you'll tell me if we're gonna do both or if we'll do one at a time. Either way, I'm okay with that.
Okay.
Okay? All right, discs are good, discs are good. There's old compression, that's whatever fun sports you played. You played pretty hard. Discs are good. They start to open there. Do we have any digestion issues going on?
Not really.
Okay. Looking at the neck is decent. We have a little bit of the reverse curve starting here. This is more posture related. This looks good here, but then it starts to curve the opposite way. I didn't see the forward curve, so I did do the flexion extension I included in the series just to get some more answers. Let's go over that. And that's going to give me the other piece of the puzzle. So in extension, you go back, no issue, okay? You go back, and then it kind of tilts back there. Now in flexion, they're fine. In flexion, they all go forward. That went forward, that went forward. That hung back a tiny bit, but still it went forward. You see the angle there?
Mm-hmm.
That goes forward, that goes forward, that angle, that's 2, 3, C4. That could also relate to your breathing, 3, 4, 5. 3, 4, 5, diaphragm.
Okay.
3, 4, 5, inhalations, taking in deep breaths. Exhalation, letting it out, it's more in the thoracic up here.
Okay.
Okay, and we'll go through. Does that make sense so far?
Mm-hmm.
Okay. You thought you were just coming for your job. Now, I don't have to do any of this, but I wouldn't be doing my work and my due diligence if I didn't go over all this stuff, okay? I'm going to see you for a couple of visits,
Mm-hmm.
and then we'll decide on a game plan, okay?
Okay.
We'll decide from there what we want to do. And let's see how you do with let's see what we find first. Any questions on the x-rays?
I don't think so.
Okay. You ready to get started?
Yeah.
So we're
Yeah.
looking at the dimples here. We know what this right dimple is lower than the left. Let's look at the overall appearance and let's walk, please. Turn, and you're going to walk several times back and forth, please.
Okay.
Cool. Keep going. You compensate very well, though. You compensate actually very well.
Oh,
So when you watch her walk, turn around. No, it's not a good thing, by the way.
Oh, it's not?
Because you hide it very well.
Oh.
That's what I'm saying. So you can see this is drop. You would expect her to swing this leg out, but what she does instead, she picks the knee up higher and takes a bigger step with her left. That's the first
People
thing.
say I'm a really strong heel walker.
It's because of the short, but more on your right side than your left side. So if you
Okay.
look at your shoes, they should be more worn out on that right side, right back heel.
Okay.
Okay? So I want you guys to watch this. This should go up and down this way. Go ahead and walk. So the left does go up and down. The right is getting stuck a little bit. Keep going. Let's try that again. The left knee turns in. Keep walking. Okay. And you feel your walk. You know what your walk's like.
I'm like trying to make sure I am walking comfortably.
Okay.
Yeah.
This is your normal walk.
Yeah.
Go for it. Do it again.
Is it changing?
I'm asking you. You just walk. There. Now you can see the shift to the right side. Okay, because she's not thinking about it.
Yeah, I was thinking a
Keep
little much.
walking. Just keep walking. So we can get a good baseline here. One more time, please. And last one. Now you can see her side hustle. All right, come back over here and have a seat. All right, I'm going to open the back of the gown now. And we need to exfoliate her too while we're
Yeah,
at
I
it.
just got back from Belize.
Oh, must be rough.
I got burnt snorkeling real bad.
Okay, so first thing you can see the overall appearance. You look at the spine, you can see that curve. The good news is you can still see all the bumps there. Disappears in there. You can see some of these blemishes here. Sometimes those are stop signs and tell us where the nerve pressure is. But this kink right here is starting from here, and this is coming from here, and this is coming from there. Okay, let's run the meter on the back. Starting at the base of the neck, let's see what we find. And the first thing we're getting is 10 points, right atlas. Right atlas, 10 points. Now, it looks like it's going to break on the left side here at T6, but it goes a little lower, 15 points, T7, T8, left side. So this is a mini thermography unit. We're measuring temperature left to right side. It's detecting the presence of inflammation at that level. We're starting down low. This is down at S5. S5. We have the one down low. And we have that one as well. So we have both of those sacrum issues. We have around T7, T8, and we have C1. Those are the ones that are showing up today, okay? Next thing we're going to do is static palpation. Static palpation, head down please. And running the fingers down the spine, looking for swelling, edema, and point tenderness. And you can see right there is where the edema starts, right there. And then it pulls in right here. 7, 1, 2, 1, 2, 3, 4, 5, 6, 7, 8, 10. 10, 11, 12, 13. That's pretty cool. She got 13 thoracics, yo. Okay, let's check your pelvis. Scoot forward, please. Feet together. Let's watch the pelvis. Open and close your knees with your feet touching. Open your knees and close your knees. Open and close. Good. Open and close. Right side only. So when she does the right, the whole left is shifting. Left side only. When she does the left, the right's not so bad. So we know this is the left sacrum, which relates back to that x-ray. Back slowly towards me, please. All the way back. All the way back in extension. That's 5. That's 1. Tender. That's 2. Let's keep the head straight, please. Just bend at the sacrum. That's 3. Tender. That's 4. A little more. That's where. Right there. No tenderness?
Okay. The first one was the worst.
Then we'll focus on the rotated side.
Right there.
Okay. So here's a good example then of, maybe we get to it, maybe we don't. Like the knee, it doesn't matter how bad it looks on an x-ray. If it's asymptomatic, don't touch the knee, don't touch the coccyx. So we're going to stay away from that one, okay?
Okay.
If it does show up along the way, we'll deal with it. But
Okay.
we have the rotated sacrum on the left side. T9, T10. 6, 7, 8, 9, 10. 10, left sacrum. Scoot back for me, please. And let's check the jaw and the neck. First thing, let's check the neck. 7, 6, 5, 4. Something may show up there later. 3, 2, C1. Let it relax there on the left. Let it drop. Let it drop. Okay. You okay?
Yeah, that's just like exactly where the spasm was.
On the left side?
Yeah.
Okay.
Right there.
That's C2. That's C1. Right there.
Mm-hmm.
Now, let's check the jaw. Open. Hold on, you're tall. Yeah, let's bring it back a little bit. Okay.
It's the extra vertebrae.
Open. So here's interesting in her case. We have a right AI with the same side EX. Open. This is all right-sided. Right, open, close. Now, I'm going to apply pressure on the bone here, okay? Let's do the C2 first. Open, close, open. Does it feel better if I push here? Or the same?
It doesn't. Same.
Do it again.
I guess it's less intense of a pop on.
When I touch?
I think so.
Okay, do the right side. Well, there's definitely a connection here. Now, from there, look up, open. Yeah, she has a right AI, right EX. And let me put my gloves on for me. Actually, you know what? We'll check the nose and all that after I do the spine, okay?
Okay.
'Cause I won't keep changing gloves. Okay. Sit up for me, please. Let's check the shoulders. And we have old ankle sprains we'll deal with later too, okay? We want a nice smooth glide. Smooth glide. They'll tell me how that is after the adjustment. You feel that?
Mm-hmm.
Okay. So, it's not as smooth as we would like it to be. This one is a little bit smoother, but it's tighter. But you're
Yeah.
right-handed also, so the muscles are more developed here
Well,
as well.
the injury too.
And the
I don't
injury,
have
yes.
as much flexibility there.
Okay. Now, here's it. You mind if I show her?
Yeah.
Okay. So she severed the median nerve,
Mm-hmm.
but she severed it peripherally from the spine. So what will be, so from here down is what was affected.
Yes.
Okay. Now, whatever we're going to work on here, I'm not seeing anything down here right now. Median nerve is coming from the base of the neck.
Mm-hmm.
Okay?
Yeah.
I'm not finding anything there, so there's nothing for us to do up there right now. We will be working on your upper cervical.
Okay.
Now, if anything does show up along the way, we'll deal with that.
Okay.
And it'll be interesting if any changes happen in the hand from what
Yeah.
we do. Okay? All right, you ready for me?
Yeah.
Here's the game plan. Now, if we look at C3, C2 is actually wedged up on the right side. So I have to correct myself here. So we're actually going to be working on C2. We're going to set C2 as a PLI. So it's gone posterior left, the wedge is on the right side. And you can actually see the bone is shifted on the right here, then the left, then the left, then the left, and then the right. So there's a lot of compensation going on there. So we have C2 we're going to deal with today. We have T10, 13, 12, 11, 10. This is actually going to be 13, 12, 11, 10. Shasha, this is going to be a little more complicated than I thought. I thought we were just going to crack a nose and a jaw and be done with it. Alright. Yes, Shasha?
Mm-hmm.
Okay, so I can justify that. We have a right wedge on C2, we have a right wedge on T10. I can justify both of those. And we're going to set that as a PRS. So we have PRS T10, we have PRI on that, on C2. And let's see what we have here. And right rotated sacrum. Okay. Sorry, left rotated sacrum. Okay, so here's the game plan. We're going to do the foundation first, sacrum.
Okay.
I'll have you walk after that. Then we're going to do your C2 here, and then we'll go over there and do, or we'll probably go here to do your T10.
What's the T10?
The mid
Oh,
back.
the mid. Okay. Okay.
Ready?
Mm-hmm.
Right side down, please. Now, can I have you slide down so your ankle is hanging off the edge, please? Perfect. Mariposa! Ah! Okay. Sacrum. PL sacrum, right there. We want to push it forward and we want to give it a little. Now here's interesting. Normally we would want to torque up. In her case, we actually want to torque it down. And the reason why is we want to lift the opposite side. Let it roll, please. That's the home run. Gotcha. Come up slowly. And let's walk that off, please, once. And you're going to walk a straight line this way. Face down over here, please. Slide up. That's it. Let's get a little more of that tailbone. She's going to be a little flexible there. That's it. Face down, or sorry, back of the chair. Back here. All the way back, please. We're going to use a seat belt. We're going to do the PRI, so we want to have the right hand up. Sorry. One more time. Right hand up. And that's just to stabilize the other torso. You're okay there?
Mm-hmm.
Cool. Sorry, PRI. That's C2. Right there. Relax the head for me, please, all the way. Nice and easy there. Okay, let that relax there. Good. Look up. There you go. Gotcha. Okay.
Yeah.
Bend left. Bend right. Walk it off once, and we're going to go on the knee chest table. Knee chest table, we're going to use gravity to assist. T10 as a PRS. 5, 6, 7, 8, 9. You good there? Mm-hmm. Okay. Tummy down. That's the home run. I got you. I got you. 5, 4, 3. Gotcha. Step away from the vehicle, ma'am. There's my hand.
Okay.
Walk it off.
Felt that like here.
As you're walking, let me just open the back, please. As you're walking, let us know if there's anything different for you. Go ahead and walk, please.
Might feel like a little taller.
Your dimples are moving a little bit more symmetrical.
Okay.
This is moving a little more up and down. Go ahead and walk, please. Keep walking 3 times by yourself. Let's run the meter after you're done. Have a seat. And let's rescope. Starting at the base. Neck is clear. T10 is clear. Sacrum is clear. Pretty cool. Let's feel the sacrum. And let's see what we got. Back slowly towards me, all the way back. From here. That's your fulcrum. Come on back. Don't be scared. Different?
Mm-hmm.
Mm-hmm. Not as sharp. Tender.
No, not nearly as like tender as it was before.
All right, let's get to the jaw now. Now the fun part. Sit back for me, please. Condyle block I'll be placing on the back of your neck. This is to stabilize the cervical spine. Do me a favor too next time. Let's get this out of the way. The bun. Open. Close. Open all the way. Now you're going to close halfway. Hold there. Okay. Open all the way. Close. Open all the way. Close halfway. There. Gotcha. Do me a favor, if we can take that stuff off later, next visit.
Okay.
Let's take those out, okay? So we're not limited. Open. Close. Open. Open. Close. There you go. Gotcha. If anything is too much at any point, just please raise your hand for me. You okay? Can handle it, right? I mean, you're a midfielder, you can do it. 5, 3, 2. Open. You got this. Open. Slowly close. That's all that extra scar tissue we'll need to deal with later, okay? 5, 4, 3, 2. Hold on.
I already knew I was gonna cry, but I couldn't.
I didn't hurt you.
No.
Just making sure. You were just holding it all in, weren't you? Okay. A little different? A little different.
Less tight, for sure.
You ready for part 2? On your back, nose. Time for the nose job. I'm going through more tissue paper than face paper this past week on your back. There you go.
Am I leaning back?
Lean back.
Okay. Sorry.
Lean back. Hands on your belly button. That side's okay. Well, they're both kind of. Breathe in through the nose and out. Breathe in. Yeah, that's the side.
Jesus. No.
Okay.
Okay.
Happy place. We good?
Mm-hmm.
Let's do it. Chin down. That's where I can go from. It'll be light. Chin down. Gotcha. Nice. Breathe. Walk off that nose job. A real crunchy in there.
A little bit.
A little bit. Let's walk it off. As you're walking, tell me if anything is different.
I don't know if I can like fully tell just yet, you know.
You can tell us next time.
Yeah.
Keep walking.
But I feel a difference. I just don't really know what it is.
Keep walking. No gym, just walking, hiking, swimming. No gym, no weights.
You didn't tell me that coming in.
You don't want to add more variables right now, just for a couple of visits. You didn't say about the gym, but I kind of just figured it watching you. So no weights for a couple of visits, okay? Just plan on the week of cardio, hiking. Have a seat. Let's recheck everything. Make sure nothing came out. Neck is clear. Mid back is clear. Just making sure. Low back is clear. Good. Let's check up top. Bend left, bend right. Good. Open. A little easier, no?
Uh-huh.
A little easier. Let's work on the shoulder. Right side, I'm reaching over. There you go. Left side, I'm reaching over. That's it. On your back over here, please. And I'm just going to start the ankles with the speeder board. We'll go in more detail on the ankles in the future visits.
Okay.
Sound is the board. There you go. Okay, stand up and let's check your hands. Come on up, squeeze the hand. Squeeze. Squeeze. Can I work on the elbow?
Yeah. Yeah.
Okay there?
Yeah.
Okay there?
Mm-hmm.
There you go. Squeeze. Squeeze. Squeeze.
You squeezing me stronger, or I'm squeezing you stronger?
Squeeze again. I'm squeezing to see if you have more strength. This is definitely stronger.
Okay.
This is a little bit better though. Cool. Do you have any questions? Any other questions?
I think my only question is like after the 4 weeks, like is there, like what is the...
Typically what I do is I see patients for 4 visits, and
Mm-hmm.
usually it's within the first week. Okay, a week, week and a half, 2 weeks maximum. And
Okay.
in that time I see how they respond, because I make an adjustment. If it's been like that for a period of time, it's gonna wanna go back.
Yeah.
Now the key is to keep your movements and your walks. We start adding weights and variables, it's just more variables, we don't know what did what then. That's why I say that. So
Okay.
the idea is each visit, things should be holding better. But with us spreading things out, I have patients that do that, it's fine. It just takes longer to fix the problem.
Okay.
But I don't know that until let's see what happens next 1 or 2
Okay.
visits. Fair enough?
Yeah.
Okay, and then we'll make some decisions if you still want to be here or not.
Okay.
All right?
Thank you.
Welcome to the office.
Thank you.